I want to talk about several things today in this conversation. One of which is friendship, and the other one is being from Macon. And it's funny how friendships develop because, I don't want to tell you all that we were at a club at the time because I just don't want to say that. But we happened to meet each other several years ago. And matter of fact, we were playing a game, a centipede. And we started competing with each other on the centipede machine and developed a friendship. And we've been friends over the years, so it's a little humbling and absolute pleasure for me to be able to interview this young man. The other thing that I wanted to mention, the concept that, if you're not from Macon, that you couldn't really have an impact, and that's not true, as proven by my friend, Mr. Andrew Galloway. Hey, man.
How you doing, Alex?
I'm outstanding.
Always a pleasure.
Yes, sir. It's good to see you. Thanks for coming on the show.
Thank you for having me.
Yes, sir. Now, that's the light stuff. Now, we're going to move from there because he's my friend and we could talk a long time, but you probably are not extremely interested in his and our chit-chatting. So we're going to move from chit-chatting to talking about something that's, just phenomenally important, that is very, very deep, and, and there needs to be some movement, not only in our community, but in our country, across the world, as it relates to health care and medicine and health care facilities and preventive health. So Mr. Galloway holds a position, well, just tell us about yourself.
Well, Alex, as you know, I'm a healthcare professional. I'm a hospital administrator by background. I came to Macon many years ago, about 33 to be exact.
Has it been that long?
It's been that long.
Okay.
And at that time, I came here with charter medical and was in the behavioral health business. I subsequently became an executive at the Medical Center of Central Georgia. And it's clear that healthcare is vitally important to not only our community, but in the nation. As you know, we passed some legislation a year or so ago. President Obama passed the Affordable Care Act, which promised to revitalize how health care is delivered and how we care for the uninsured in our country. It has since become a political hot potato and garnered some of the most divisiveness that I've seen in public policy and government, which is not good. But it speaks to the level of importance of this issue to all concerned.
Well, now, talk a little bit about it, because there are a lot of people who don't understand the concept, the benefits, the advantages, and the process.
Sure.
Because I do know that, well, I'll let you say it and expound on it, but I do know that a lot of people die, and then I know that it costs, the company for which you are contracting a lot of money, because there's not enough emphasis and resources for healthcare. But just talk about that Obamacare, and if you would, it's something that I don't understand. If you could editorialize a little bit, as it relates to why there is so much editorialization, if you please,
right,
against Obamacare.
Well, by way of background, the healthcare costs have been escalating for several decades to the point where they were almost out of control. And it's gotten to the point where healthcare was consuming too large a percentage of our gross domestic product, our total economic output.
Yes, sir.
Too much of that was being consumed by healthcare considerations, and if not brought into check, something was going to have to be done dramatically to keep our economy from collapsing. So one of the reasons that healthcare costs have escalated out of control has been the fact that we have so many uninsured in our country. Estimates range anywhere from 40 to 60 million Americans without any form of health insurance, which means they have no ability to access the healthcare system in our country. Many consider healthcare to be a basic human right, certainly a basic human need. And without the ability to have access to high quality care, the quality of life, not only for the individual, but for the community and the nation, are dramatically at risk. So with that said, many government administrations have wanted to tackle this problem. As you know, President Bill Clinton, in his first administration, took on the healthcare issue as one of his primary goals, and that did not work out so well. Timing wasn't right, and what emerged from that administration wasn't really what was needed to move that issue forward. It was one of those things where it's best to kind of keep it simple. If you remember, the Clinton healthcare playbook was, some 1,500 pages. It was just too much, when basically what was needed was someone to say, healthcare, insurance, everybody gets it, and the employers, you're going to pay for it. It could have been just that simple, but of course most things aren't as simple as they could be. So that failed. President George W. Bush made some inroads. If you remember, he revised the Medicare program to include Medicare Part D, which gives access to Medicare beneficiaries for medications and that sort of thing. But it wasn't all that was needed to help fix this broken system. So President Barack Obama was determined to make this a primary issue, and in fact was successful in getting the legislation passed, which we know as the Patient Advocacy and Affordable Care Act. And it has there are lots of details, but it has two basic premises. The patient advocacy portion deals with issues like eliminating the ability of insurers to have patients declared out of benefits, out of coverage because of a prior condition,
right,
and those sorts of things. So the Affordable Care Act addresses those types of issues. It also extended the ability of working parents who have health insurance to keep their dependent children who are in college or something on their programs until they are age 26. And it places the burden on the insurers to make sure that people have access, who have insurance, have access to the type of coverage that works for them. Now the other part of it deals with closing that gap for the uninsured, and it would do so by making it possible for every individual, in fact mandating that every individual have some form of health insurance coverage. If you have it through your employer, then you might be unaffected. If not, you could access coverage through the Affordable Care Act or through a state program which was generated through the Affordable Care Act.
Now we didn't,
No.
Georgia did not latch on to that state program.
That's
Is that
precisely
true?
right, yes. And that's critically important. You mentioned the divisiveness about this issue. It really isn't about health care, about the issue, about any of the stalking horses that the opponents put forward to indicate reasons why this was not a good program. But in reality, we've had virtually 10 million Americans who did not have health insurance a year or so ago who now have coverage. That number could grow by 50%, maybe even double, if the states who elected not to expand their Medicaid programs, like Georgia, were to do so. Bring in another 5-10 million almost immediately. And it's pure politics. This issue is not so much about health care as it is about presidential and governmental politics and who's going to wield that kind of power. And the unfortunate circumstance is that innocent Americans who otherwise could have coverage don't have it. It's been estimated that in the red states, typically these states are in the deep South, with Republican administrations who have opted not to adopt the Affordable Care Act or expand their Medicaid programs to include people in the Affordable Care Act. They've adopted not to for what I consider to be purely political reasons. And it's estimated that annually 300 to 500 Americans in those states who have opted not to expand their Medicaid programs will die as a result of not having access to good health care.
In each state?
No, totally. Yeah. And there are, a couple dozen or so states who have opted not to expand their Medicaid program, which I want to tell you is a no-brainer. I mean, it's absolutely a no-brainer. The states declared, well, it's an unfunded mandate. We're going to have costs associated with expanded Medicaid. Well, the federal government has said not so. We're going to pick up 90% of the cost of the Medicaid expansion for 100% for the first 3 years, and thereafter 90% of the cost of expanding their Medicaid programs. Well, that's a no-brainer, but for political reasons, it hadn't gotten done in many states, and Georgia's one of them, and it's unfortunate. But it's clear now that the Affordable Care Act is working. We don't know yet what the ultimate impact will be. We know that it's saving lives because people who had no access to care now have some access. And as those numbers grow, as the number of people accessing the Affordable Care Act grows and the number of uninsureds declines, we're going to see the overall health status of Americans rise.
And it can influence every segment of our community. If people are healthy, they can go to school, they can work, they can take care of their family, they are less likely to commit crime.
Absolutely.
Psychologically they are better, so I mean I can see, and I think this is an excellent time because, you all have worked and are familiar with healthcare in our community, but, the Medical Center of Central Georgia, I'm sure is affected by the Affordable Care Act, but prior to the Affordable Care Act, then this facility was charged with the responsibility of taking care of those individuals who were not insured. Talk a little bit about that, historically what the Medical Center has done. Sure. And I'm sure that, because now all hospitals don't do the same thing, and all counties, municipalities, all governments don't take the same approach to it, because I think in one of our conversations when we were talking about when there was when they were trying to determine, the budget, for the new consolidated government, you mentioned what some other communities were doing. I'd like for you to give those figures and just talk about how all of that ties in.
Absolutely. First of all, the Medical Center of Central Georgia is a tremendous asset for this community. And I think that gets lost on many of us because we take things for granted. It's a monolith up downtown on that hill, and it delivers world-class health care and has done so for... I
think I saw where you all got some kind of recognition last week.
Oh, absolutely. Yeah. It's continued. This community enjoys a level of healthcare resources unprecedented for a community of its size. To have, well, first of all, to have a level 1 trauma center in your community is, I can't tell you how valuable an asset that is. If you are involved in a serious injury or a life-threatening illness, that level 1 trauma center at the Medical Center of Central Georgia is there, available, staffed with the appropriate physicians and equipment 24/7, 365. I mean, on the premises. For example, if you travel from Atlanta southwest and you have a serious injury, say you have an accident on the interstate or something like that, the only thing between you and almost certain death may be that level 1 trauma center at the Medical Center of Central Georgia, and there's not another one between Atlanta and Tallahassee as you travel southwest from Atlanta towards the Florida line. So critically important and such an asset to the community. Obviously, the Medical Center operates a neonatal intensive care unit, things that are cost centers. They're not profit centers. So in order to be able to offer those kinds of important needed services, you have to have a margin somewhere else in your operation in order to pay for it. And the Medical Center has been blessed to be able to shuffle and react to the different changes in our health system to make it able for them to do that. The Medical Center is involved in the education of physicians and allied health professionals. Well, we are training the next generation of physicians for our community and for other areas of the state. Again, it's a cost center. It costs money to do that, and our ability to be able to offer these kinds of critically important services for which you cannot charge enough money to pay for what they cost, you have to have a profitable margin elsewhere in your organization. We, as you know, recently went through a budget debate with the newly formed government over the funding of indigent care. And again, these are patients who have no other means of insurance, no other means of payment for the care that they received. Healthcare economics differ from mainstream economics in this way. We have an emergency room there, and we are required by law to render care to anyone who needs it or who presents themselves there.
But if I go to Walmart with no money, they got.
You know, I talk to people. I talk to people all the time who pretend not to understand. You know, you may be in the fast food business, and you don't understand how it's different that if you have a McDonald's and you are required to give somebody a Big Mac when they present at your door is different from somebody at Burger King who does not have that same responsibility. So they pretend not to understand what they do, of course. But that's why healthcare economics differs. It doesn't conform to the traditional laws of supply and demand and things of that nature. So we have to be flexible in the way we approach care. The other way is the consumer really can't make a demand on the health system. You or I cannot admit ourselves to the hospital. We can't prescribe a medication. That requires a physician. So you got the ultimate consumer, who's the patient who needs the service. You have the physician or other allied health professional who can authorize the service. You have typically a third party who actually, either through your employer, through a health insurance program, an employer-based health insurance program, or otherwise, who pays for the service. So with that caveat, healthcare economics is very different from traditional fee-for-service economics. Well, we presented, as we do every year, a bill to the county government for the indigent care patients that the medical center has cared for on their behalf. And it's not, we always talk about we're asking for funding. Well, we're not asking for funding. We presented a bill and demand payment for services. Well, you don't really need it. Well, that's great, but you don't pay bills based on the perceived need of the service provider. I filled up this morning on the way down here. Last time I checked, ExxonMobil was the biggest corporation in America. Now, I feel quite certain that they did not need my $4 a gallon, but if I wanted gas, guess what? I had to pay
That's
for it.
pretty good analogy.
I had to pay for it. So we went into this budget process, and we had to be mindful of the fact that we had a newly consolidated government that was still feeling their way, and that there might be some problems. I didn't expect the kind of problems that emerged, but we knew that the process might not go as smoothly as it had in the past. And the government is still learning, and I believe as we go forward, that will get better. But there was an indication early on that there might be some problems because of the way the budget process was rolled out. In the past, every stakeholder in the county budget was invited to come down and make a case for their line item items in the county budget, and to explain and to defend them. And this was done during the budget preparation process. So at the end, there are no real surprises. The new government did not take that approach, and partly because this newly consolidated government places, I believe, a disproportionate amount of responsibility in the executive branch of government. In our form of government, we have separation of powers. We have a legislative branch, which would be the commission that makes the laws. We have an executive branch that carries them out and administers them, and we have a judiciary that interprets what both of them did.
Right.
And that balance is important because it not only, first of all, it's too big a job for any one branch to do on its own, but it's also important because it prevents any one branch from accumulating, perhaps consolidating, too much power in one branch of government.
Yes, sir.
So this whole budget process that we went through this spring was as much about the balance of power and the wielding of power as it was about money. And the county commission, I have to first give them thanks. I think they took a very thoughtful approach. I want to thank all of the commissioners who supported what I think was a critically important issue, and that is supporting the Medical Center of Central Georgia and their indigent care needs. It was not certain how that would go. We had some freshman commissioners, Commissioner Mallory Jones. I can't give him enough thanks. He proved to be an independent thinker who had some concerns and questions in the budget of his own, and was willing to compromise and send that budget back to committee to get another look at it. Likewise, Commissioner Al Tillman, and again, another freshman who, as far as I know, was his first elective office, but he proved to be a real statesman in balancing the need to have a balanced budget with community needs. and of course, the veterans on the commission who supported the indigent care issue of Commissioners Elaine Lucas, Bert Bivens, and Virgil Watkins. They've all had prior service, and we knew how they felt regarding these critically important community needs and the absolute requirement to balance that.
Okay, we're kind of running out of time, but where did this leave us? I mean, as it relates to the process, as it relates to indigent care,
Yes.
as it relates to moving forward, and is there anything the community can do? First of all, we need to realize the role that, how many people you all employ?
Well, again, I forgot to get to that part of my,
Well,
my
just
talk.
go ahead.
Yeah,
Go ahead.
the medical center is $1 billion corporation. It's not just a monolith there downtown, employing between 5,000 and 6,000 individuals.
5 and 6 what?
1,000. Typically, the largest employer in the county. And I can't tell you, when you look at that, the size of that payroll and those high-paying jobs and what that does to our economy, you can do the math. It's an invaluable asset. Other communities have understood the importance of keeping that healthcare asset healthy and vibrant and taking some responsibility for paying for indigent care. That's why it was so shocking when this administration determined that there was no money in the budget to do so. If you had $1 billion corporation who was seeking to come to your community and employ 5,000 plus people, you would be
Doing monkey flips.
boogaloo down Broadway, doing handsprings up Mulberry Street to get them here,
Yeah.
and to suggest that you do nothing to keep them here and healthy was really kind of shocking. And I think our commissioners ultimately recognized that and said, listen, that's not the right message to send, and we want to
Well, we really appreciate you, and believe it or not, I might need to let you host this show because you can talk, and you've done a great job. And we appreciate you. We appreciate what you do.
Thank you,
and
sir.
we have a phenomenal degree of appreciation for Central Georgia Health Systems
absolutely.
and the Medical Center of Central Georgia, and an enormous amount of appreciation for the elected officials who are trying to work through
Yes.
all of these processes, but not on the backs
Yeah.
of the people who can least afford it. So this is a call to action.
A call to action.
I'm your host, Alex Habersham. Having interviewed my friend, my compatriot, and an individual who is contracted with the Medical Center of Central Georgia, Mr. Andrew Galloway. Thank you very much, sir.
Thank you for having me.
Not making black pages.com.